Hi, I'm Ian Butler. I'm an ICU doctor at Palomar Medical Center. I'm actually the medical director for the ICU there, and I'm going to share with you some of the things that we do for patients currently with coronavirus and COVID-19 in our hospital. Additionally, we'll talk a little bit about what you might do at home if you're worried you have it, how to get tested, and finally, I'll give you some of the ideas about what's coming on the horizon with things like vaccines and what to expect for 2021. So you can see here are topics to be discussed. We're going to talk about current hospital treatments, and we're going to be talking about oxygen, steroids, remdesivir, as well as convalescent serum that you may have heard about. And additionally, you probably heard President Trump got hospitalized and what extra things he got that aren't currently on the market. We'll talk about a home approach of what to do if you feel you may have it and what signs and symptoms you might have, as well as how you may or may not be able to tell the difference between the flu and COVID. Finally, when we talk about the COVID vaccine, I'll tell you a little bit about some of the trials that are being done, what to be expected when it actually does come on the market, and whether or not it will be safe and how it will change 2021. So first and foremost, patients that have coronavirus don't all need to be in the hospital. But when they do, it's usually because they require oxygen. So an oxygen requirement is what we call it when somebody needs oxygen that doesn't normally otherwise need it. And this is, for us, an easy way to determine how sick somebody is. If you're sick enough to need oxygen from a coronavirus infection, we're generally going to be admitting you to the hospital. And one of the things you'll probably definitely get will be steroids. There was a British study that came out a couple months ago that showed that there actually was a mortality benefit. In other words, fewer people died when they got steroids if their disease was so severe that they needed oxygen. So for the most part, everyone in the hospital is going to get that. Another mainstay of our treatment is remdesivir. Remdesivir is an IV medication that is directly aimed at preventing coronavirus itself from replicating in your system. You can see a lot of graphs and numbers here, but basically the take home is you recover faster, have fewer bad events, need less oxygen, and overall probably die less if getting this medicine. So almost all of our patients are going to get this unless there's some contraindication. Something else you may have heard about is convalescent serum or plasma. Basically what this is we take somebody who's already been infected and recovered and try to isolate their immune response, their antibodies, to the virus itself, and then put it into you. Well, we can't be so specific as to isolate the exact antibodies, so we just kind of take the serum and hope that it works. There's a lot of common sense behind how this could work because we use it in other diseases like diphtheria, or originally when we were doing things like rattlesnake antivenom or rabies, tetanus, things like that. The reality is, though, we don't have good studies saying that this is working in coronavirus. We tend to do it anyways, although some folks decide not to go with the plasma because it's not proven and it is coming from somebody else's body, which does have some inherent risk, kind of like getting a blood transfusion. Finally, you may have heard when Trump went in the hospital, he got something extra special. It was made by a company called Regeneron, and basically it's an antibody that they develop specifically against some of the spike proteins, which are the outer part of the coronavirus, aimed at trying to actually arrest the virus in the person's system. This medicine has been shown to decrease the amount of virus in somebody's body, and by definition, probably should make them get better faster. This medicine is still being trialed for safety, and something that while President Trump got it, I don't know that we should quite give it to everybody until we know that it's safe, and getting it onto the market will probably take another couple months, expected in 2021, and some other similar medications as well. So in summary, if somebody's hospitalized for coronavirus, it's probably because they needed oxygen. And when they come in, they're pretty much always going to get steroids like dexamethasone, remdesivir, which is an antiviral medication, sometimes plasma, and in the future, new treatments that will be coming out. So that's what would happen if you were hospitalized and what kind of treatments you would get. But what about if you're just at home and start to get the sniffles? When should you get tested? What are the symptoms of coronavirus and how would you know it's not the flu? Those are some things I want to tell you a little bit about. I actually had a scare myself. A few weeks back, I found myself with a slight cough, maybe a low fever, and the sniffles. And I said to myself, well, I have to go to the work at the hospital in a few days, and it was just the start of the weekend. What could I do, and did I possibly have it? Well, first of all, it's not flu season right now, so the likelihood that it was the flu was pretty low. That being said, it's always possible. My first and biggest concern, though, was it possibly coronavirus? Now, the signs and symptoms of coronavirus start usually with a fever, but not everybody gets it, shortness of breath, which fortunately I didn't have, and also often a cough, runny nose, the typical upper respiratory tract infection type symptoms. If you start to get those in the current day and age with this pandemic going on, I think it's probably worth getting tested and isolating yourself from everybody, especially your family at home. I've seen so many situations where a whole group of people come in, one person got it, gave it to their brother, gave it to their sister, gave it to their mother, and then to their father, and now the whole house has it. If one person feels like they may have it, they should isolate themselves in their room, wear a mask, even in the house, wash their hands, and then go and get tested. Another time you should get tested is if you come in contact with somebody who later calls you up and says, hey, by the way, turns out I had it. That sounds like kind of a far-fetched thing. The reality is I get phone calls all the time from friends of my own who are asking for advice saying, hey, I just found out my brother-in-law has it. Now he's hospitalized. Should I go get tested? The answer to that is yes. You can have coronavirus and not have any symptoms at all, which is great for you, but bad for people you might pass it on to. So for that reason, if you think you may have it, or if you know you've been in close contact with somebody that did or does, you should go get tested. So how are you going to go about doing that? Well, there's a couple ways. One of them, and this is kind of amazing, is you can just get it done free at any CVS. What you need to do ahead of time, though, is go online, just Google CVS, find their coronavirus testing, set an appointment, and go to it. I said any CVS, probably not a small one in like a Walmart or something, but the larger standalone CVSs. You drive up, they do the test, and send it off. Currently, in October of 2020, this is free to be done, and people go and take advantage of it. In my situation, I actually said, well, I need that result sooner, in which case I looked around, and there are different places you can get this done. The one that I used was called US Specialty Labs, but I was able to get a same-day test. Now, again, I had symptoms of a little bit of a cough and a runny nose with a very low fever, definitely had a viral infection of some type, and so I needed to know the answer pretty much that day so that I could decide if I was going to go to work in a few days. That's how I went and got tested. The test, yeah, it's uncomfortable. They stick something way up your nose and move it around a little bit. They'll know whether or not they got enough of a sample based on how the test is run. You'll know because it's going to be uncomfortable when they do it. That being said, it wasn't as unbearable to me as some people say, although I could understand if you don't like things in your nose, it would be something you might run away from. Lastly, you can actually do this test yourself. So go online, LabCorp, look for their at-home testing. They'll send it to you free. It came to me within, I think, 24 hours, and you can do the test, send it off, and have the results back within 48 hours. I didn't end up doing it that way because I needed to get my result immediately done. But before I figured that out, I had actually ordered one online, and that's how it came to me. Maybe, what about this whole thing of, is it just the flu or another virus? You know what? It might be. And in my case, it wasn't coronavirus. It wasn't the flu. It was just some other small little upper respiratory tract infection virus, right? But here's the thing. In the current day and age of the pandemic, you need to know if you have an upper respiratory infection, whether or not it's coronavirus. And so you should definitely go get tested. Don't just brush it off and say, it's probably not. Make sure you go and find out that it isn't. So let's talk a little bit about some hope, like vaccines. Well, I don't want to put a damper on the parade, but the reality is the vaccine is not going to be a silver bullet. In order for a vaccine to be considered efficacious or workable, it should at least cover about 50%. You've probably heard our flu vaccines are sometimes only about 40% effective. In other words, getting a vaccine is really great to decrease the number of cases that are going to happen, but not as good for an individual who it may not work for. There are multiple vaccines that are currently in the market being tested, and one of them, Johnson & Johnson's, had to be paused last week because of some health concerns. There's going to be more that are paused. That being said, I think we can expect to have a vaccine from one of the 20 or 30 that are being tested by the end of the year, by 2021. It's going to be in short supply. It probably will first go out to people taking care of coronavirus patients, then eventually to everybody else. Probably not in the general population until sometime early to the middle of 2021. So until then, you need to keep yourself safe. Let's talk about keeping safe. Do masks really work? Here's where I get my thinking. And I'll tell you what, I was initially skeptical, because I'm always skeptical. Will a mask really work? There have been studies where they took a bunch of guinea pigs, masked them up to see whether or not they did or did not get it. And guess what? Having a mask on the guinea pig actually decreased the amount of coronavirus they got. So there is animal evidence to say it's true. There's also pretty good evidence from things like studies where there was a school, for example, that I think about over in Israel, where the kids all wore masks, and then on a hot day for 2 days, they took their masks off. Immediately following that, there was a massive outbreak, and they had to close the school down. A bunch of people in the community got it as well. Pretty directly traced to masks. There's another study that I like to think about where there were these Swiss soldiers living in barracks, and the group that weren't wearing masks in barracks A all got really bad coronavirus, and the ones that put on the masks when they heard that those guys all got it, while they got it, not nearly as much, and it was much less severe. So I think there's good evidence to say masks work. The other thing is social distancing. And by social distancing, I don't think you're going to necessarily get coronavirus just by being in proximity to somebody, but being in proximity to somebody without a mask, they don't have a mask to protect you, you don't have a mask to protect them and yourself. Maybe in a situation like a recent study came out from Japan saying people that went to bars were more likely to get it. Well, it makes sense. In a bar, it's noisy, you're talking loud, there's probably more aerosols and droplets going in the air as you're shouting across the bar at your friend. That would be kind of an unsafe place to go. Currently, you're not going to find me in a situation like that. There are other situations, like sporting events where everybody would be cheering. Those are probably going to stay shut down for a little while. But if you're in a situation where you see there's a lot of people shouting, making loud noises, that's probably a place where it's less safe, even if folks are all wearing masks. So in addition to wearing masks, there's also just kind of some common sense that should enter into your thinking. So I don't want to close things out on all doom and gloom. The reality is there's some hope for the winter. As we're looking at the southern hemisphere, which goes through a flu season before we do, guess what? They're not having a very bad flu season. Turns out wearing masks and washing hands doesn't just prevent coronavirus, it prevents the regular flu as well. So I'm hopeful we're going to have one of the most mild flu seasons ever. And in fact, maybe we'll have learned some lessons and have less of a flu season going forward. I do want to encourage everyone to get the flu vaccine. While it may only be 40 or 50% effective, the reality is it prevents thousands and thousands of hospital admissions and thousands of deaths. So getting that vaccine is something that I do, not just to keep myself safe, but to keep everybody safe as well. I did want to share this graph. This shows flu cases in the southern hemisphere, in particular South Africa, Australia, New Zealand, those sorts of places. And look what happened. They are not having a flu season at all. They've had maybe 50 cases or something like that. The reality is social distancing, wearing masks helps with the flu and coronavirus. So maybe things are not going to be so bad if we all wear our masks, practice common sense with our social distancing, wash our hands, and get the flu vaccine. Well, we know that steroids decrease the mortality, so help people live. We know remdesivir seems to have some effect there as well. I can say that the mortality that we're experiencing now compared to early on in the pandemic is a lot less. And so for that reason, I would have to say that our treatments are having an impact on mortality. Early on, it was hard to know what mortality really was, but it definitely is better than it was 3-4 months ago. You know, one of the things we worry about in any virus is its ability to mutate, and there have been mutations with the coronavirus. Currently, none of those mutations are ones that would make our vaccines ineffective. That being said, there are always the possibility of a mutation that would render our vaccine ineffective, and we'd have to make another one. That being said, if we can get control of this virus in a way that it's not so widespread and severe, I think a little pocket here and there of a new strain would be something that we'll be much better equipped to deal with. You know, there's been a lot of discussion about this, and there have been case reports where, for example, somebody went into an elevator where the button had been touched and they supposedly got coronavirus by touching that same button. I don't know if that's true or if the person just coughed in the elevator and the virus was in the air there, but most of us feel that the risk is high enough to get it off of objects, what we call fomites, that we all wash our hands quite a bit. That being said, if you ask me what's the primary mode of transmission, it's probably more droplets in the air that people cough out that we then breathe in. You know, most hand sanitizers are actually targeted at destroying the virus itself. And so if you said to me, wash my hands with soap and water versus use a hand sanitizer, the answer is the sanitizer is probably more effective. I bet if you washed your hands for 10 minutes and were really meticulous about it, you could do just as good a job. But using something that actually kills the virus makes more sense to me. Well, the cons of doing any new vaccine is it could have some sort of health side effect that we don't know about until it's tested on large amounts of people. In general, that's something that I wouldn't say is completely insignificant. That being said, hopefully we will have already gone through phase 1, 2, and 3 testing of all of these vaccines, and it will have been tested in tens of thousands of people when it comes out. My guess is there's not going to be enough of the virus, of the vaccine rather, to go around for everyone. And so you'll have tens of thousands of healthcare workers getting it. And unless you're one of those people, you probably won't have early access to the vaccine. The biggest concern that I have around the holidays are the people that are at greatest risk of having harm. So, for example, my parents. I'm a lot less worried about giving it to somebody my age, my health, and a lot more concerned about giving it to my parents. So for this holiday season, unfortunately, I'm not going to be visiting them. There's going to be an inherent risk of travel, which is basically going outside of your little bubble into another bubble and then transmitting the virus that way. But there's also concern about going and hanging out with people that you love that are at risk of having the greatest harm from this virus. So as far as a safe protocol, if I was going to go and visit my family, I would isolate myself for several days to make sure that I don't have symptoms, that I'm not getting sick. I probably would go and actually get a test to see that I didn't have it. And if I had a negative test and was quarantined for several days, then I would be more comfortable going and visiting some of my at-risk family members. So again, I'm Ian Butler, ICU doctor at Palomar Health, and thank you for joining me for this little bit of time to talk about coronavirus and hopefully answer some of the common questions you might have had or people might be asking you. Most importantly, stay healthy, keep the mask on, practice common sense with your social distancing, and when you go around, and have a safe and happy holiday season.